My husband is a cardiothoracic surgeon. When I collapsed in our kitchen on a Tuesday morning, he stepped over me to answer his phone. I need to back up. My name is Adrian Hollis. I'm 31 years old. I'm a licensed clinical social worker at Vanderbilt University Medical Center in Nashville, Tennessee. I have a master's degree, a caseload of 40 patients, and 6 years of experience sitting across from people in crisis and knowing within minutes when something is genuinely wrong. I know what a medical emergency looks like. My husband is Dr. Callum Hollis, 41 years old. Cardiothoracic surgery. Chief resident at Vanderbilt, which means he operates on hearts for a living. He has been in medicine for 19 years. He graduated top of his class from Emory. His attendings say he has the steadiest hands in the department. He also told me for 2 years and 3 months that the crushing fatigue, the joint pain, the rashes across my cheeks and chest, the hair falling out in the shower in handfuls were stress, burnout, anxiety, possibly depression. Definitely not something to make an appointment about. He was a doctor after all, he would know. On March 14, 2025, my kidneys were failing. I had a creatinine level of 4.2. Normal is under 1.1. I had lupus nephritis stage 3, and I had been walking around with it for over 2 years because my husband, the cardiothoracic surgeon who operated on strangers' hearts, looked at his wife's symptoms and said, "You're just tired, Adrian. We both work too hard." He wasn't in our kitchen when I collapsed. He was on the phone in the hallway 8 feet away, talking to his attending about a case scheduled for that afternoon. I heard him say, "Hold on a second." I heard his footsteps. I felt the floor vibrate as he walked toward me, then past me. Then I heard him say, "Sorry, go ahead. The case at 2, yes?" Our neighbor Francine, 67 years old, retired school teacher. The woman who used to bring us banana bread when we first moved in, she called 911. She had seen me through the kitchen window. If you've ever been dismissed by the person who was supposed to know you best, hit like right now, subscribe if you want to know how this ends, because it gets so much more complicated than I ever expected. I need to take you back to the beginning. September 2022, I was 29 years old and we had been married for 14 months. Callum and I met during his fellowship year when I was doing an internship rotation through the cardiology unit. He was charming in that specific way that exhausted men in medicine can be charming, efficient, decisive, good at making you feel like the only person in a very crowded room. We got engaged after 8 months. My mother cried happy tears at the brunch where he proposed. My older brother, who is an accountant in Memphis and has never trusted anyone in medicine since our dad's misdiagnosed appendix rupture in 2009, shook Callum's hand very carefully and said, "Welcome to the family." My first symptom appeared in November 2022, a rash across my cheekbones and the bridge of my nose, butterfly-shaped, bright red. I noticed it after a weekend of particular exhaustion, the kind of tired that doesn't lift after sleep, that sits behind your eyes like pressure. I showed it to Callum over dinner. He glanced at it, then back at his food. "Rosacea," he said, "it's very common. Get a good SPF and a gentle cleanser." I am a social worker, not a physician. I had no reason to question a cardiothoracic surgeon's offhand assessment of a skin condition. I bought SPF 50 and a fragrance-free cleanser. The rash faded slightly. I moved on. By March 2023, my joints had started hurting, my knuckles in the morning, my wrists, some days my ankles. I work a sedentary job. I sit in a chair across from patients for 8 hours a day, so there was no occupational reason for it. I mentioned it to Callum. "Adrian, you're hunched over a desk all day. Your ergonomics are probably terrible." He didn't look up from the chart he was reviewing on his laptop. I bought an ergonomic chair. It cost $340. My joints still hurt. April 2023. Hair loss. Not the normal shedding you notice when you clean the shower drain. Clumps. A handful in my fingers every time I washed my hair. I started wearing it pulled back because I was scared to look at it down. I took photos on my phone to document it, date stamped, because I am a social worker and documentation is what I do when I'm frightened and don't know what else to do. I showed Callum the photos. He scrolled through them with his thumb. Telogen effluvium, he said. Stress-related hair loss. Very common in women your age in high-stress careers. He handed my phone back. Are you sleeping enough? I slept 8 hours a night. I had always slept 8 hours a night. I started taking magnesium because someone on a women's health forum said it helped with stress. June 2023. The fatigue became something else entirely. I started canceling dinner plans with friends. I stopped going to my Saturday morning yoga class, a class I had attended for 4 years without missing more than a handful of sessions. I would come home from work and sit on the couch and feel a bone-level exhaustion that I did not have the language to describe to anyone who hadn't felt it. Like gravity had doubled. Like existing was an effort. I told Callum I was worried something was wrong. He was eating leftover pasta at the kitchen counter. He set his fork down. Adrian, you carry other people's trauma for a living. You see 7-8 patients a day. Burnout is not a character flaw. It's a clinical reality. He said it gently. He said it the way I imagine he talks to patients' families before a difficult procedure. With that specific brand of warmth that also communicates, I have assessed this situation and I am now telling you the conclusion. Discussion is informational, not collaborative. You might want to talk to someone, he added, a therapist. I am a therapist, I said. He smiled. You know what I mean. I made an appointment with a psychiatrist colleague. She screened me for depression, generalized anxiety, and burnout. She said I had mild depressive symptoms, likely situational. She prescribed a low-dose SSRI. I took it for 4 months. My joints still hurt. My hair still fell out. The rash came back every time I spent any time in sunlight. I developed mouth sores in July. My ankle swelled enough in August that I had to buy new shoes because my old ones wouldn't fit comfortably. I called him on a Tuesday afternoon from my office. Callum, I said, I need to see a rheumatologist. Why? Because I have a butterfly rash, joint pain, fatigue, hair loss, mouth sores, and now edema. And when I put all of those things together, they don't add up to burnout. He was quiet for a moment. I could hear the ambient noise of the hospital in the background. Adrian. He said my name with patience that was not quite patience. It was Patience's more condescending cousin. I'm a physician. If I thought you had something systemic going on, I would tell you. These symptoms are nonspecific. They appear in dozens of presentations, most of them benign. You're catastrophizing. It's very common in people who work in medical-adjacent environments. They learn the vocabulary of illness and apply it to normal fluctuations in how they feel. I'm not catastrophizing, he sighed. I'll order some basic blood work, okay? Just to give you peace of mind. He ordered a basic metabolic panel and a CBC. Both came back within normal limits. He showed me the results over dinner with the expression of a person who had just been proven right. I want to be clear about something. I did not drop it. I brought it up again in October 2023, in January 2024, in April 2024 when I started getting headaches that wouldn't respond to ibuprofen, in July 2024 when I noticed that my urine had changed foamier than normal, something I knew from my graduate health courses could indicate protein in the urine, which could indicate kidney involvement. I mentioned the urine. He said I was overhydrating and to drink less water. Each time he had a clinical explanation. Each time, it was delivered with a certainty that made my own observation feel small and paranoid. He was a cardiothoracic surgeon. I was a social worker who had read too many WebMD threads. That is what gaslighting does when it comes from someone with medical credentials. It doesn't feel like manipulation. It feels like being corrected by an expert. You don't just doubt your symptoms. You doubt your ability to perceive your own body accurately. You start to wonder if you're the kind of person who creates illness narratives for reasons you don't fully understand. You become afraid to mention it again because the way he explains it away makes you feel slightly hysterical, and you are a mental health professional who knows what hysteria looks like, and you do not want to be that. So I mostly stopped bringing it up. By February 2025, I had lost 16 pounds without trying. My face was a different shape than it had been 2 years before. A colleague at work, another social worker named Philippa, who I've known since graduate school, pulled me aside after a staff meeting and said, Adrian, are you okay? You look unwell. Not tired, unwell. I told her I'd been having some symptoms I couldn't explain. She asked if I'd seen a doctor. I said my husband was a doctor. She looked at me for a long moment and then said, "That's not what I asked." She said it the way I'd said similar things to clients over the years. Carefully, precisely. With the full weight of what she wasn't saying contained in the pause after the words, I made an appointment with a physician outside the Vanderbilt system, a general practitioner in Brentwood just outside Nashville. I told her everything. All of it, from the rash in November 2022 to the foam in my urine in July 2024. I brought my dated photographs. She listened for 40 minutes. At the end of the appointment, she said, "I want to run an ANA panel. Today, if possible." ANA stands for anti-nuclear antibodies. It is a blood test that screens for autoimmune disease. It takes about a week to come back. It costs, depending on your insurance, between $40 and $120. My husband had never ordered one. The results came back on February 28, 2025. Strongly positive ANA. Anti-disDNA antibodies present. Low complement levels. The physician called me herself on a Friday afternoon and said she was referring me to a rheumatologist urgently. She said the results were consistent with systemic lupus erythematosus. I sat in my car in the Vanderbilt parking garage for 22 minutes after the call. I wasn't crying. I was doing the math. 2 years and 3 months. 16 months of asking. 16 months of being told it was burnout, stress, anxiety, self-diagnosis hysteria from a woman who read too many medical forms. I drove home. Callum was already there, which was unusual. He'd had an OR cancellation. He was in the living room reading. I stood in the doorway and I said, "I have lupus." He looked up. I told him about the ANA results, the antibodies, the referral. He was quiet throughout. When I finished, he set his book down on the coffee table and he said, "Adrian, an ANA alone doesn't diagnose lupus. You know that." I looked at him. "I know," I said. "The rheumatologist will confirm it, but I need you to understand that I have been telling you something was wrong for over 2 years. He said, "I based my assessments on your reported symptoms and the results I had available." I said, "You ordered a basic metabolic panel once?" He said, "I'm not a rheumatologist." I said, "No, but you told me I didn't need one." He didn't answer. He picked his book back up. I went upstairs and called my brother in Memphis, who listened for a long time and then said, "What do you need from me?" The rheumatologist's name was Dr. Ferreira. She was 51, Brazilian-born, had been practicing at Vanderbilt for 14 years. She reviewed my blood work, my photographs, my symptom history. She examined me for over an hour. She ordered a urine protein to creatinine ratio. It came back at 4.8, normal is under 0.2. She called me into her office and she said, "Adrian, your kidneys are involved. I want you to have a biopsy this week." The biopsy confirmed it. Lupus nephritis class 3, focal proliferative. She explained that class 3 has about a 15 to 25% risk of progression to end-stage renal disease if untreated. She said, "Based on your symptom timeline, this has been progressing for at least 18 months, possibly longer." She said it gently, but she said it. Then she asked a question that made my chest tighten in a way that had nothing to do with the lupus. She said, "Was there a reason you hadn't been evaluated sooner? You presented with essentially classic lupus symptoms from very early on, the butterfly rash, the photosensitivity, the joint involvement, the hair loss. A good ANA panel in late 2022 or early 2023 would have caught this much earlier." I told her my husband was a physician, that I had reported my symptoms to him repeatedly, that he had reassured me each time that it wasn't serious. Her expression didn't change much, but she was quiet for a moment in a specific way. Then she said, "I see." 2 words. But the way she said them. She referred me to nephrology. She started me on hydroxychloroquine and a short course of prednisone. She said the kidney damage from the delay meant I would need more aggressive treatment than an early diagnosis would have required. Mycophenolate. Possibly, if I didn't respond, Benlysta. which runs about $2,500 a month even with good insurance. Callum drove me to the nephrology appointment. He sat in the waiting room while I was seen. On the way home, he said, "I'm sorry I didn't take it more seriously." I looked at him. 6 words. After 2 years. After 2 years. After 16 pounds. After kidney damage. After the hair and the rash and the joints, and every time I said something was wrong and he looked at me with that clinical patience and explained why I was mistaken. "I'm sorry I didn't take it more seriously." I said I know. I didn't say anything else. I want to tell you what happened on March 14th, 2025. Because that was the day everything changed. Not in the dramatic way that had already happened with the biopsy results. This was different. This was the day I understood something I had been slowly circling for months. I had woken up that morning with a headache unlike anything I'd had before. Sharp, behind my eyes. My blood pressure, which I had started monitoring at home after the nephrology appointment, read 162/104. Severely elevated. I felt wrong in the specific way that people in my position, people who have been told they were wrong about their own bodies for 2 years, sometimes talk themselves out of honoring. I sat down at the kitchen table. I was trying to decide whether to call Dr. Ferreira's after-hours line or wait until the office opened. I was doing what I had learned to do, weighing my symptoms against the memory of all the times I'd been told I was overreacting, and then the room tilted, and then I was on the floor. I don't remember the fall. I remember the tile against my cheek. I remember the kitchen light looking very far away. I remember hearing Callum's voice in the hallway, on the phone. I heard him walk toward the kitchen. I thought he was coming. I tried to say something. He walked past the doorway. His voice kept talking. Francine called 911 from the window of her house next door. I don't know how long she'd been watching. She told me later she'd seen me sit down heavily at the table and then simply disappear below the window frame, and she didn't wait. She just called. The EMTs arrived in 6 minutes. My blood pressure at that point was 178/112. My creatinine, drawn at the ER, was 4.2. A nephrologist on call, Dr. Adami, came to see me within an hour. He said, "Your kidneys are in acute distress. We're admitting you." I was in the hospital for 9 days. Callum came to the hospital. He sat by my bed. He held my hand. He talked to my attending physicians in the way that physicians who are also husbands of patients sometimes do, partially as a family member, partially as a colleague, and the complicated mixture of both that the nurses seemed to navigate carefully. I watched them be very polite to him. On the 4th day, my brother drove up from Memphis. He walked into my room, looked at me in the hospital bed, looked at Callum sitting in the chair by the window and said, "Can you give us a few minutes?" When Callum left, my brother sat on the edge of my bed and said, "Adrian, I need you to tell me everything. From the beginning. All of it." So I did. He listened without interrupting. When I finished, he didn't say anything for a moment. Then he said, "Has he apologized? I mean, really apologized. Really apologized. Not sorry I didn't take it more seriously. An actual apology that acknowledges what this was." I thought about it. I said, "No." He said, "Okay." He went home that evening, and 2 days later he sent me the name and contact information for an attorney in Nashville who specializes in medical malpractice. Her name was Judith Okafor. My brother had done 3 hours of research before finding her. He's an accountant. Research is what he does when he's scared and doesn't know what else to do. I also need to tell you what Philippa did, because Philippa is important. On the day I was admitted to the hospital, Philippa texted Callum to ask what had happened. He told her I'd had a blood pressure event related to an autoimmune condition I'd recently been diagnosed with. She asked how long I'd had the diagnosis. He said, "A few weeks." Philippa knew that wasn't entirely accurate. She had been there for the February conversation. She had asked me if I'd seen a doctor and watched my face when I told her my husband was one. She called me that evening. I told her everything, including the part where I'd been telling him about my symptoms for 2 years, and the part where he'd walked past me on the floor to keep talking on the phone. Philippa was quiet for a long moment. Then she said, Do you want me to write down what I witnessed? Officially? Because I'm willing to do that, I said. I don't know yet. She said, okay, whenever you're ready. I'm not going anywhere. When I was discharged on March 23rd, Dr. Ferreira met with me privately before I left. She had reviewed my full medical history, including the records from Callum's brief basic workup in late 2023. She sat across from me with her hands folded on the table and said, Adrian, I want to be direct with you. The standard of care for a patient presenting with your symptom cluster in 2022 would have included an ANA panel. At minimum, what I'm seeing in your record is a pattern of dismissal that delayed diagnosis by approximately 2 years. Given that you are a medical professional and your husband is a physician, there are ethical dimensions here that I feel I need to name. You had a right to an appropriate diagnostic evaluation. You did not receive one. She asked if I had an attorney. I told her my brother had found one. She said, good. She said, if you need documentation from me, you have it. I met Judith Acoffer for the first time on April 3, 2025. She had read the materials my brother had sent her, the symptom timeline I typed up, the dated photographs, the medical records I requested from Callum's practice, and a written account from Philippa. Judith was 54 years old. She had been practicing medical malpractice law in Tennessee for 26 years. She was the kind of person who gives you information without cushioning and lets you decide what to do with it. She said, what you're describing isn't simply a marital dispute or a husband who made a mistake. Your husband had a physician-patient relationship with you. He documented your visits. He had an affirmative duty of care. He did not meet the standard of care. And the delay in your diagnosis has resulted in measurable permanent harm. Specifically, kidney function you will not fully recover. Permanent. I'd understood it intellectually. Hearing her say it out loud was different. She also said something that I had been thinking about but hadn't been able to fully articulate. She said, the people who do this, physicians who dismiss family members' symptoms consistently over a long period, often do it because they need to maintain a particular self-image. The expert in the room, the authority. Acknowledging that you were right would have meant acknowledging that they had failed. And for some people, that is not a cost they are willing to pay. I thought about every dinner where he'd explain my symptoms back to me. Every time he'd use clinical vocabulary to make my experience of my own body feel like a hypothesis he'd already evaluated and rejected. Every time the implicit subtext was, I have assessed this, and the assessment is that you are fine, and if you continue to feel otherwise, the problem is with your perception, not with your health. I filed a formal complaint with the Tennessee Department of Health's Division of Health-Related Boards on April 10, 2025. The complaint cited failure to meet the standard of care, conflict of interest in treating a family member without appropriate referral, and documented pattern of symptom dismissal, leading to delayed diagnosis and organ damage. Callum found out the day the complaint was filed because I told him. We were in the kitchen. The same kitchen where I'd been on the floor in March. He was standing by the coffee maker. I sat down at the table and I said, I filed a complaint with the medical board. And I've retained an attorney. He turned around slowly. I watched his face do something complicated. Then he said, Adrian, this will end my career. I said, you ended mine first. Not my career, my health. The one thing I'll carry for the rest of my life regardless of what either of us does next. He said, I made a mistake. I know I made a mistake. But going to the board, I said, you walked past me on the floor. He didn't say anything after that. My brother drove up the following weekend and helped me move my belongings to Philippa's guest room. She'd offered before I even asked. She'd already bought the good brand of coffee and cleared space in the bathroom cabinet. Philippa also wrote her statement. 3 pages, single-spaced, notarized. She described our February conversation in detail. She described the way I'd said my husband was a doctor when she asked if I'd seen a physician. She wrote, in my professional opinion as a licensed clinical social worker with 11 years of experience in medical settings, Miss Misson. Hollis's presentation was consistent with someone who had been conditioned to doubt her own clinical observations through repeated delegitimization from a perceived authority figure. I've used more technical language than I might otherwise choose because I believe the board deserves the full clinical weight of what I witnessed. I read it and had to put it down for a few minutes. Dr. Ferreira submitted a written opinion as an expert. 14 pages. She walked through the symptom timeline, the standard of care at each point, and the measurable outcome of the delay. She wrote, "The kidney damage sustained by Miss Peel. Hollis is consistent with a diagnosis of lupus nephritis that was allowed to progress for approximately 24 months without intervention. Early treatment in 2022 or early 2023 would, with a high degree of probability, have prevented the current degree of renal impairment. The failure to order basic autoimmune screening in the presence of the documented symptom cluster represents a significant departure from accepted standards of care. Dr. Adeyemi, the nephrologist who admitted me in March, also submitted a statement. He had reviewed my records. He wrote that in his 18 years of practice he had not encountered a more clearly indicated diagnostic workup that had been more consistently deferred." The Tennessee Board of Medical Examiners opened a formal investigation in May 2025. Callum retained his own attorney. He did not contest the core facts, the symptom reports, his documented assessments, the timeline of the workup he had and had not ordered. His attorney argued that he had acted within the reasonable judgment of a non-specialist who was managing a complex family situation. My attorney filed a civil suit in June 2025. Damages sought, medical costs, ongoing treatment costs. The Ben listed alone will likely cost over $30,000 a year for the foreseeable future, lost wages during hospitalization, and punitive damages for documented professional negligence. The civil trial is scheduled for February 2026. There are things I did not expect. I did not expect Dr. Ferreira to become the person she became in this process. She calls to check in, not as a physician, or not only as a physician, as a person who saw something that troubled her and decided to do something about it. At my last appointment, she said, "You are one of the easiest patients I have ever had to advocate for because you documented everything." She paused. "The photographs," she said. "The photographs were very good." I did not expect Francine to cry when I told her what had happened. She brought banana bread again. She sat in Philippa's kitchen and said, "I saw you through that window and I just knew." She shook her head. "I just knew something was wrong." I said, "You saved my life." She said, "I just called. You're the one who survived it." I did not expect my brother to say what he said when the board opened the formal investigation. He called me and said, "Adrian, I have to tell you something. When you were in the hospital in those first 2 days, I was so angry I could barely think, and I didn't want to make it about me, so I said nothing except what I thought you needed to hear. But I need you to know that I knew. When you got engaged, I knew something about him felt like he needed to be the smartest person in every room. I just didn't know it would cost you this." I didn't know what to say. I told him I loved him. He said, "I know. Now get some sleep." I am writing this from Philippa's guest room, which now has my grandmother's quilt on the bed and a photograph on the dresser of me and my brother at his daughter's 3rd birthday 2 summers ago. My creatinine has stabilized at 1.6, still above normal, likely permanent but no longer in the danger range. I take 7 medications every morning. I wear SPF 50 every day without exception. I will have labs drawn every 3 months for the foreseeable future. I'm also back at Vanderbilt. I returned to work in May. My patients don't know what happened. They sit across from me and tell me about the ways their lives have fractured, and I listen. And I ask the questions I've been trained to ask, and sometimes I know something they don't yet, that the fracture is not the end, that it is sometimes the thing that finally shows you the shape of what was always there underneath. Last week I had a session with a woman in her late 20s. She came in presenting with anxiety and fatigue. She mentioned that her husband had suggested therapy. I asked her the questions I always ask. I asked about sleep, appetite, physical health, support systems. At the end of the session, she said, "I've been having some symptoms I can't explain. I keep thinking something's physically wrong, but my husband says I'm overanalyzing." I said, "Has your primary care physician evaluated you?" She said, "My husband usually handles that kind of thing. He's a PA." I looked at her for a moment, then I said carefully, "Your husband's medical background doesn't replace a formal evaluation. What you're describing deserves its own appointment, with someone whose only job is to look at you." She nodded. She wrote something down. I don't know what she has. Maybe nothing. Maybe something she'll catch early because she listened to herself instead of to the person who needed her to be fine. I hope it's nothing. But I know what it means to have someone finally say your experience is real and it deserves to be investigated, and you were right to keep asking. People ask me what I would tell my 2022 self, the one who showed her husband the butterfly rash over dinner and believed him when he said it was rosacea. I don't have a clean answer for that. I was not naive. I was not passive. I asked 16 times over 2 years. I documented. I photographed. I pushed until pushing felt like the thing that was making me crazy. What I tell her is this: your clinical instincts were correct. The same instincts you've spent 6 years training. The same ones you use to help other people understand what's happening inside them. Those instincts were right, and the person who kept telling you they weren't, that was not expertise. That was something else. Something smaller and more frightened than expertise. A physician's credentials don't override your lived experience of your own body. Trust yourself. My name is Adrienne Hollis. I'm a licensed clinical social worker in Nashville, Tennessee. I have lupus nephritis and some permanent kidney damage and a civil trial scheduled for February. I have a brother who drives 3 hours when things go wrong, and a friend who keeps the good coffee, and a neighbor who called 911 through a kitchen window and saved my life. I also have, for the first time in 3 years, the ability to sit with what my own body is telling me and believe it. That's enough to start with. There's something I keep coming back to even now. The butterfly rash appeared in November 2022. I showed it to my husband over a dinner plate. He glanced at it for maybe 2 seconds and said rosacea, and I believed him. Not because I was naive, not because I didn't have instincts, but because I had been taught the way most of us are taught, that credentials are a form of truth. That a person with enough letters after their name has earned the right to define your reality for you? What I know now is that credentials and integrity are not the same thing. They can exist together. They often don't. What happened to me wasn't random. Every time I brought a symptom to my husband and he explained it away, he made a choice. A small one maybe, in the moment. Easier to say burnout than to order a test. Easier to say anxiety than to sit with the possibility that he might be wrong. Those small choices accumulated over 2 years into something that permanently changed my kidneys, my medications, my life expectancy curve. Cause and effect doesn't always announce itself. Sometimes it's very quiet. Sometimes it looks like a husband eating pasta and saying, "You should talk to someone." The hardest thing wasn't the diagnosis. It was learning to trust myself again, after someone I loved had spent 2 years teaching me not to. That's the part nobody prepares you for. The way sustained dismissal from someone with authority reshapes how you hear your own voice. I had trained for 6 years to recognize distress in other people, and I had completely stopped recognizing it in myself, because every time I did, a surgeon told me I was wrong. What saved me wasn't a dramatic moment of clarity. It was Philippa asking one careful question and not accepting the easy answer. It was Francine watching through a kitchen window and deciding that what she saw was enough to act on. It was my brother driving 3 hours and sitting on the edge of a hospital bed and asking, "Has he actually apologized?" It was Dr. Ferreira saying I see in a way that meant everything without saying anything else. Integrity, I've learned, looks like those moments. It looks like Philippa writing 3 notarized pages because she thought I deserved to be seen accurately. It looks like a neighbor calling 911 because she trusted what her eyes told her more than what would have been convenient to assume. And what I had to rebuild in myself, what 2 years of being told I was wrong had worn down, was the willingness to think clearly about my own experience and act on what I found. To say, I have a butterfly rash and swollen joints and foam in my urine, and I know what these things can mean, and that knowledge is not hysteria, it is information, and I am going to find someone who will take it seriously. That's not stubbornness. That's the only kind of persistence that keeps you alive. I'm still in treatment. I'll be in treatment for a long time, but I went back to work in May, and last week I sat across from a woman whose husband had been explaining her symptoms away, and I asked her whether she had seen her own doctor, not her husband's opinion. Her own doctor. She wrote it down. I hope she makes the appointment. I hope she finds someone who listens on the first visit. I hope she never has to learn what I learned the way I learned it. On a kitchen floor alone, while the person who should have been paying attention was already talking about something else.